Taking a shower or bath is an important daily routine to keep us clean and comfortable, especially in a humid environment. But for people who are bedridden patients, they need to take their baths in bed with the help of a nurse. I am Christelle and Babon from BSN 1N. In this video, I am going to demonstrate how to bathe patients and attend to their hygienic needs. Before everything else, wash your hands and apply gloves so that you will have a clean hands before dealing with your patient. Next step is to gather and prepare all the equipments that you will be needing and place it within your reach so that you keep everything in order and to work efficiently and continuously. Next step is to explain the procedure to the patient. Let the patient know what you are about to perform so that they will be informed and understand what you are going to do. And also, do not forget to assist the patient's preferences about the procedure. Hi ma'am, good morning. I am your student nurse for today and I'm going to bathe you, which means I will be going to wash your body to remove dirt and oils on your skin. And also, for you to feel refreshed, I will start cleaning your face, your neck, and followed by the rest of your body. Would that be okay? Yes. Okay, but before that, I will assist you to brush your teeth and give you BEDPAN for your elimination needs. Okay? And I would also like to ask if this hygiene products is okay to use with you, ma'am? Yes. Okay, so is there anything else you need before we begin our procedure? Okay, great. So let's start. So the next step that I am going to do is I will close all the windows and doors to provide the privacy for the patient. This will make my patient comfortable during the procedure. And also, I will prepare the environment, which is turning off the air conditioner or fan to prevent chills of the patient. So beginning with the oral care, as we all know, oral care is the state or practice of keeping the mouth cavity in a healthy condition by brushing and flossing it. So in order to practice and maintain good oral health, you must practice a good dental hygiene. This provides oral care of the teeth, gums, and mouth, as well as to remove offensive odors and food debris, and promote patient comforts and feeling of a well-being. Effective routine of oral hygiene is essential for hospitalized patients because it helps to maintain the health of the oral cavity as well as the overall health of the patient. Step 1 is to wash hands to prepare for the procedure and to have a clean hands before dealing with the patient. Number 2, gather all the equipments that you will be needing to keep everything in order and to save time and to work efficiently and continuously. Number 3, provide privacy. Privacy is important for the patient in order for them to feel safe and comfortable. Number 4, apply your gloves. So by wearing a gloves, this can be a preventive measure to prevent the spread of microorganisms or any infections. Number 5, explain the procedure to the patient. This is to ensure that the patient will understand and inform of what the procedure you are going to make. Number 6, place your patient in a Fowler's position. This is a semi-sitting position which is a 40 to 60 degree angle to have a better chest expansion and to have a proper execution of level of work during the procedure. Number 7, arrange the articles within the client's reach to keep the patient's safety when doing the self-care. Number 8, place a towel across the patient's chest to avoid wetting from any spillage spit, and the towel also helps to avoid direct skin contact of any contamination. Number 9, moisten the toothbrush and apply small amount of the toothpaste and let the patient brush her teeth and gums. This is applicable only for the patient to know self-care. This also helps to remove debris and that has accumulated in the mouth as well as to avoid oral infections. So you may teach your patient about how to do the proper toothbrushing. So it should be the gums have friction in a vertical and circular motion, and all the surfaces of the teeth must be cleaned thoroughly at every angle. Next up is assist the client in rinsing her mouth. This is to ensure that the patient is thoroughly rinses his or her mouth to ensure the removal of any particles or extra toothpaste. This also prevents water from spilling over the bed by assisting your patient. Number 11. Assist the client flossing and brushing as necessary. While the patient is brushing or flossing, position the mirror and the illnesses basin and water near the client so that it will be in the reach. And assisting the patient will enable them to wash and floss their teeth effectively and ensure the removal of any food particles, and it will be properly clean. Number 12. Assist the client in rinsing and drying her mouth. This is to ensure that the patient thoroughly rinses her mouth to remove any extra toothpaste or any large debris particles, and by assisting your patient, this also prevents from water spilling over the bed. Number 13. Apply a lip moisturizer if appropriate and give the patient a mirror. So by applying a moisturizer, this will help the lips to keep them out from drying out. Number 14. Reposition the client. Raise side rails and place cold water within the reach to maintain the patient's safety and comfort. Placing a cold button within the reach of the patient enables the patients to quickly call the attention of any attending nurse in the event of an emergency, and this will also help to ensure the patient's safety. Next up is to remove your gloves and wash your hands to be prepared for the next procedure, which is the offering of the urinal. And lastly is to document the care, which is to assess the patient's present condition and to document a nursing care. This to record your documentation. You may record your observations to the patient's mouth. With the offering of urinal or BEDPAN to the patient. So in order to assist the patient who is unable to get up or go to the bathroom for the purpose of urinating or defecating, urinal or BEDPAN equipment should be made available to them. So the purpose of this procedure is to provide an opportunity for the patient to eliminate their body waste, to keep their body in an optimal health, and to avoid any harmful bacteria that may cause an illness to them. So the very first step of this procedure is to prepare all the materials that you will be needing. So this is to keep everything in order and to work efficiently and continuously. Number 2, do the hand hygiene or the hand washing and put gloves after drying to make sure that you have clean hands before handling the patient. Number 3 is provide a privacy. Privacy is very important for the patient's comfort and safety. Number 4, explain the patient about the procedure. This is to ensure that the patient will know and will understand to the procedure that you are going to make. Number 5, determine if the patient needs help in urinating or defecating. This is to determine or to evaluate the patient's independence in doing so, as well as to protect the patient's privacy. Number 6, assist the patient in a comfortable position. This is to ensure that the patient is comfortable during the procedure and may avoid any difficulties during the defecation. Number 6 is to assist the patient in a comfortable position. This is to ensure that the patient is comfortable during the procedure to avoid difficulties during elimination. Next step is to position the urinal or the BEDPAN properly and gently if the patient needs assistance. So if you are assisting a female help the patient spread her legs and cover for privacy. While if you are assisting a male, put the penis in the opening at the top of the urinal and cover for privacy. So by assisting a patient, this will avoid any spillage and to ensure that the patient's body is in a proper position to avoid difficulties during elimination. Number 8 is when the patient is done urinating or defecating, carefully remove the bedpan or the urinal equipment. This is to avoid prolonged exposure to the body waste, which could result in contamination. Number 9 is do the perineal care. Use damp washcloth for wet wipes for women and be sure to wipe the area from front to back. Put on new gloves after. This is to ensure that the private areas are well cleaned after elimination. And also changing gloves will prevent any cross-contamination. Number 10 is to dry the area between the patient's leg. This is to provide comfort to the patient and prevents a sweaty feeling down there. Number 11 is to analyze and measure the patient's waste output. This is to monitor and ensure that the patient has a proper intake of fluid or food, and also this will help to determine whether there is an adequate output of urine or stool as well. Number 12 is empty the urinal or the bedpan into the toilet. This is to discard the urine or the stool in order to avoid contamination or prolonged exposure, which could result in the spread of microorganisms. Number 13 is to rinse and wash the urinal or the bedpan using a disinfectant diluted with water. Dry the urinal or let the air dry out. This is to ensure that the microorganisms are eliminated from the bedpan or urinal, making sure that it is safe to use for later use. Number 14 is to take off your gloves and dispose it properly to the trash bin. This is to prevent a cross-contamination. Number 15, assist the patients to do the hand hygiene. This is to ensure the cleanliness to the patient's hand in order to prevent any infection or contamination. Number 16 is to do the aftercare, which is to return all the equipment to its proper places so that it will be ready for its next use. And lastly is to do the documentation by assessing the patient's condition both before and after the procedure. This is to assist in the monitoring of the system's performance and the patient's current condition, as well as to provide in nursing care.
Okay, Mom, I'll give you time to eliminate and I'll be right back to check on you, okay? If you need anything, just ring the bell and I'll be right here right away. Hello, Mom. Have you finished on the bedpan?
Yes. Okay.
Okay, Mom. I will just dispose this and I'll be right here right away.
So I already washed my hands and applied new set of gloves. So the next step is to place bath blanket over the top sheet and remove the top sheet from under the bath blanket. And allow the patient to remove her accessories under the blanket. So during the bathing procedure, the bath blanket is utilized to cover the patient's body, and this would ensure the patient's comfort and privacy.
Is to place the soiled top sheet in the hamper. Next step is to fill the wash basin with 2/3 full of water. Permit the client to test the temperature of the water
water with hand. Water should be changed when soap film develops or the water becomes soiled. This will ensure that the water temperature is suitable for the patient to give them comfort and to prevent chills. By changing also the water when soap film forms, this will avoid the bacteria returning to the washcloth. Next step is to wet the washcloth and wring it out. This is to wring out the extra water to prevent them from dripping. Next step is to make a bath mitten with the washcloth. So, using a bath mitten, this will assist in thoroughly cleaning and bathing the body and removes dirt. So the next step is to place a towel under the head and across the patient's chest. So wash the face starting from the eye, inner and outer, with an S pattern for forehead, face, neck to ears. Use different side of washcloth in each area during the washing. So soap rapidly dries up the skin on your face. Wash from inner to outside corner, taking care not to spread particles on the client's eye. The use of separate section of the meat for each eye prevents infection from spreading. Next is to wash the arms, forearms, and hands using a long, firm strokes, following distal to proximal direction. Then wash the axilla and apply deodorant if needed. Cleaning all the surfaces, this is to remove the dirt that could result in a skin infection. Applying deodorant are also needed to ensure the patient's comfort and feels refreshed. Soak hands into basin for about 3 to 5 minutes. Wash hands, interdigit area, fingers, and fingernails. By soaking and washing the hands, it ensures that all dirt and the dead skin cells are removed.
and then pat and dry the hands using the towel. And then repeat procedure to the other side of the hand. Next step is to place a towel across the client's abdomen and fold the bath blanket down to the umbilicus under the towel. This will make easier for you to reach inside part of the body. To wash abdomen using long firm strokes, then rinse and pat dry after. This would ensure that every part of the upper body is cleaned thoroughly. After cleaning is complete, always cover the area of the patient's body to maintain the privacy and avoid chilling. Is to replace bath blanket over the chest and abdomen and remove the used towel.
is to wash the legs and feet with long, firm strokes, following distal to proximal direction. Expose leg farthest from you by folding bath blanket to the midline. Bend the leg at the knee, grasp the heel, elevate the leg from the bed, and cover the bed with bath towel. Place wash basin on towel, place client's foot into wash basin, and allow to soak while washing the leg with long, firm strokes in the direction of distal to proximal area. After that, rinse and pat dry the leg. Clean soles, interdigits, the toes. Rinse and pat dry again. This would ensure that the lower part of the body is cleaned thoroughly by cleaning it one by one. And also by allowing the foot to soak, this will help to loosen the dirt and remove the dead skin cells. Next step is to wash the back of the patient. Assist the patient in the prone or side lying position facing away from you. Wash the back and buttocks using a long firm strokes. Rinse and pat dry. Give a back rub and apply lotion. This will allow an easier access to the patient's back portion, ensuring that it is properly cleansed. Also, by giving a back rub and applying lotion, this provides the patient a comfortable and relaxing feeling. Next step is the perineal care. Assist the patient into a supine position performing the perineal care. Allow the patient to do the perineal care on his or her own if she or he is capable. Assist the patient to ensure the proper cleaning of the private areas.
Is to change a washcloth for rinsing and drying the area. Next step is to do the aftercare, which is returning all the equipment that you use to its proper places so that it will be ready for its next use. After returning all the equipment, wash your hands and remove the gloves and dispose it to the trash bin so that you avoid contamination.
So the very last step of this procedure is to do the documentation. This is to evaluate the patient's condition prior to the following procedure. This would provide the nurse feedback about the patient's degree of satisfaction of the following order and also to do a nursing care intervention.